Hello guys, welcome to Dr. Science. So today we are going to talk about surgery basics, and in this basics I will be mainly talk about what is the difference between feeding gastrostomy and feeding jejunostomy. So first we will talk about what is meant by feeding gastrostomy. So imagine this is the esophagus. The esophagus will eventually lead into the stomach, and this is the abdominal wall. So we are going to open the abdominal wall, and through this foramen we are going to place a tube into the stomach, and through this tube we are going to pass the food. This is called as your feeding gastrostomy. So in feeding gastrostomy we are going to keep the tube into the stomach, and through that tube we are going to feed the patient. So it is called as your feeding gastrostomy. The next thing is your feeding jejunostomy. Once again, this is the esophagus of the patient. Esophagus will eventually lead to the stomach, and stomach will eventually lead to duodenum, and finally we have the jejunum, which is nearly 10 centimeters away from the ligament of Treats. Imagine this is the abdominal wall, and we are going to cut open the abdominal wall and place our tube into the jejunum, and through this tube we are going to feed the patient, and this is called as your feeding jejunostomy. So enteric feeding is mainly divided into feeding gastrostomy and feeding jejunostomy. Feeding jejunostomy is usually done if the duration is greater than 4 weeks, and feeding gastrostomy is usually done if the duration is less than 4 weeks. I hope you are clear with this term. Thank you guys.